Welcome to Moments with MamasteFit. In this episode, I'm going to be sharing my personal pelvic floor birth preparation, what I was doing during pregnancy to help not only stay comfortable throughout my pregnancy, but also to prepare for a really positive and empowering birth experience. Welcome to Moments with MamasteFit. My name is Gina. I'm a perinatal fitness trainer and birth doula and the co-founder of MamasteFit, and I'm going to be sharing about my personal pelvic floor birth preparation. If you enjoy these episodes where we're sharing a case study to discuss a specific client, patient, our own personal experience, and how we approached an issue that they were having and how we resolved it so that you can utilize it for your own individual journey, be sure to subscribe to our channel so you get notified whenever we release new episodes. New episodes with Moments with MamasteFit come out every other Friday in conjunction with our birth stories. So before we dive into what I was doing during my pregnancy to prepare my pelvic floor for birth, let's first discuss what is a pelvic floor. The pelvic floor sits at the bottom of your core canister at the bottom of your pelvis, and it's a sling of musculature that helps to support your pelvic organs. So as females, we have our bladder, our uterus, and our rectum that the pelvic floor is all supporting. And so it's going to play a big role in supporting your baby as the uterus grows throughout pregnancy. In addition, the pelvic floor, because it's at the bottom of your pelvis, is also the base of your core canister, so it's going to help with stability of your spine and postural control. The pelvic floor also plays a big role in sphincter control, where it's going to close up to keep things in and open up and relax to let things out, such as your pee and poop. It's going to play a big role in sump pump, so it's going to help with lymphatic flow throughout your body, especially throughout the pelvic region. And then it has a sexual function, so it helps with orgasm, in addition to a big role during childbirth. During birth, the pelvic floor plays a big role in how your baby's head is positioned, and so we want relatively even tension throughout the pelvic floor so that your baby comes into a chin-tucked position, which is going to allow your baby's head to be smaller as they fit through your pelvis. Sometimes if we have uneven tension within the pelvic floor, it can make it harder for your baby to enter into the pelvis, and it can also cause them to tilt their head sideways or maybe even extend their head as they try to navigate the pelvis, which can cause them to present a little bit bigger than normal. The pelvic floor also has a habit of turning on and starting to compensate for when other muscles are not doing their job like they're supposed to. So during pregnancy, our inner thigh musculature, sometimes our glutes are not as active as they're supposed to be. And so sometimes the pelvic floor will turn on a little bit more to compensate for them. And so if the pelvic floor is doing somebody else's job, it sometimes doesn't do its own jobs very good. And this is where it can cause some discomfort or issues during pregnancy and some dysfunction in the postpartum period. And so for my own pelvic floor story, during my pregnancy, I was having some bladder urgency, which meant that I felt like I had to pee all of the time. And every time I went, there just wasn't a lot of pee coming out. I was also experiencing a lot of pelvic heaviness, and it almost felt like my baby was super low within my pelvis and overall just really uncomfortable for me. In addition, I was also experiencing some right SI joint pain. Sometimes when I walked, it wasn't overly debilitating or affecting my daily life, but I was starting to notice it a little bit more, and the exercises and releases that I was doing to help correct it were just not quite doing enough for me to be completely pain-free. And so towards the end of my third trimester, I decided to do a birth prep session with our pelvic floor physical therapist, Haley Kava. She works here in our gym at MamasteFit and then also offers virtual pelvic consults as well. During my session, Haley did an internal exam, which you can get during pregnancy as long as there's no other contraindications for internal assessments. And what she discovered was the right half of my pelvic floor was really active. So it was overactive and really compensating hard to work for muscles that were turning off around the pelvis. And so because of this, it was causing my baby to be pushed more forward onto the bladder, and it was causing a lot of that discomfort and bladder urgency for me. In addition, the back half of my pelvic floor, particularly the left half, was very tight, which was decreasing space towards the back half of my pelvis and also pushing my baby forward onto my bladder. So the combination of these two places of tension where I had an overactive right half and a very tight back half of my pelvic floor was causing a lot of that bladder urgency, that feeling of heaviness for me, and it was also impacting my baby's ability to drop into my pelvis to get into a good position in preparation for birth. And this pelvic floor tension was also shifting the way that my pelvis was positioned, causing some of that pelvic pain for me as well. The way that my pelvis is positioned is really similar to how a lot of our pelvises are positioned. It's just a normal asymmetrical positioning of the pelvis. The right half of my pelvic floor sits a little bit more back, and the left half of my pelvic floor sits a little bit more forward. So the right half of my pelvic floor is in a more posterior position where it's tucked underneath. I have more internal rotation of the pelvis in addition to adduction, so it's moving more inwards. While the left half of my pelvic floor sits more forward, so it's in more anterior pelvic tilted position, so it's a little bit more forward. I have more abduction, so it's more outwards, and external rotation. So my left hip is in a more open hip position, and my right hip is in a more closed hip position. And because of this torque within my pelvis, it's really impacting the tension within my pelvic floor. And this is a really common positioning for a lot of us, known as left AIC. So the left posterior pelvic floor is tighter as the tailbone shifts to the right, while the right half of the pelvic floor is going to be more lengthened and have a little bit more overactivity. So the first thing that we did to help address this pelvic positioning and to release that uneven tension within my pelvic floor was Haley did some internal release on the right half of my pelvic floor, which felt a little painful in the moment, but it did bring a lot of relief for me to just kind of turn this muscle off and allow it to relax again. In addition, we did some release on that left posterior pelvic floor to stretch it and to release some of the tension and tightness that it was feeling. After the session with her guidance, I was using an internal wand to also release my pelvic floor. And so it was a Thera wand. They also have intimate rows that you can do where you insert it vaginally and then you can massage different portions of the pelvic floor. I found that using the pelvic wand was more accessible for me during pregnancy because I just couldn't reach there with my own fingers. And so the pelvic wand was a really nice tool that I utilized within the shower and then if I was taking a bath to help relax my pelvic floor. I didn't really do any perineal massage during my pregnancy in preparation for birth because there's not a lot of evidence that supports it really does a lot for you. Evidence is really mixed on whether or not perineal massage helps to prevent tearing or if it doesn't help to prevent tearing. And for me overall, I found the things that are more impactful on whether or not I tear is how in control I am of pushing and whether or not my provider believes that I'm going to tear or not. If your provider believes that you don't need to tear, they're going to take steps to help you not tear. So warm compresses, water birth, helping to slow down the crowning, relaxing your legs. And so they're going to take steps to help decrease the risk of tearing. If your provider believes that everybody tears no matter what, they're probably not going to do a whole lot to help decrease that risk of tearing. And they may tell you to push as hard as you can when your baby is crowning. And so if your provider is the first half where they believe that not everybody has to tear, you're probably in good hands and your risk of tearing is probably a lot lower than if you had the latter type of provider. The things that I found personally to help decrease my risk of tearing over perineal massage was one, being able to feel my baby coming out by putting my hand on their head so I can kind of feel where they were, and that gave me good feedback to push a little bit harder or to slow down. I was unmedicated for my last 3 labors, so I could feel what was happening down there as well, and so I knew when to slow down and when to push a little bit harder. My midwife also used a warm compress during 2 of my births to help decrease my risk of tearing, and in my last labor, I was in the water, which helps to decrease the risk of tearing as well because there's a little bit more lubrication and moisturizing with the water. So I didn't do any perineal massage during my pregnancy to help decrease my risk of tearing because there's a lot of mixed evidence on whether or not it does decrease your risk of tearing. And I also personally just found it really uncomfortable and would rather focus on internal pelvic floor release because one, that helped me be more comfortable during my pregnancy and I felt played a bigger role in my labor than just a perineal massage. In addition to the internal release techniques, we also were focusing on exercises to change the pelvic position, which was going to change the tension within my pelvic floor because all of these pelvic floor muscles attach to the pelvis. So because the right half of my pelvic floor sits more backwards and the left half sits a little bit more forward, we were finding exercises where my pelvis came into the opposite position, where I brought my right hip into a more open hip position, where my knee moved away from my belly, and my left hip into a more closed hip position, where I found more of a hip shift or belly more towards the thigh on that side. And if you want to see the specific exercises that I was doing to prepare my pelvic floor for birth, check out our latest YouTube video where I share my pelvic floor birth prep exercises. One of the exercises that I was doing was an open hip lunge, where I was finding more of an open hip position on the right side. So I was in a half lunge position. I was rotating my belly away from the thigh. And so I was feeling more of a stretch kind of in that right adductor, right groin type area. And I was bringing my hip into that left side. So I was shifting my weight into the left side. And this was helping to offload the right half of my pelvic floor so that it could release and to let go. I also would have something underneath my right big toe to help with kind of the rotation of my leg, which helped to impact my right pelvic cap position as well. Because our pelvis does not operate in isolation. Our rib cage positioning, our foot positioning are all going to be things that impact how our pelvis can position as well, which is going to impact the tension within your pelvic floor. The left side, we were coming into a more closed hip position, so I was finding more hip shifts to help stretch that left posterior portion. And so with a hip shift, the pelvis is shifting onto itself to find a more internal rotation. So the belly is rotating towards that thigh and changing the tension within that back half of the pelvic floor. And so hip shifts are something that are really incorporated within the MamasteFit prenatal fitness program because how beneficial they are to releasing tension within the pelvic floor. For a lot of us, we tend to have more tension in the back half of the pelvic floor. And so hip shifts are really great to releasing the tension back there. So if you're having SI joint pain, tailbone pain, issues with like constipation, just general discomfort in the low back area, sometimes hip shifts can be the one movement that really helps you out. For a lot of our fitness clients, especially in person, when we walk them through a hip shifted exercise, they report back that they have so much relief from just common discomforts that they were having during their pregnancy. And so for me, I was finding a lot of hip shifts, especially on that left side. And so because my pelvis was in a more asymmetrical position with the right half back, left hip more forward, the exercises that I was doing were also one-sided. I wasn't necessarily doing exercises on both sides because not both sides needed the same thing, which can be a little hard to accept and to comprehend because we're used to doing things evenly on both sides, but our body is not symmetrical down the center. We have kind of different needs on both sides. And for me during my pregnancy, I had different needs on each side as well. So I'd primarily focus on open hip positions on the right side, strengthening my glute and quad muscle on the right side. And this was all helping to offload that right half of the pelvic floor and that overactivity there. On the left side, I was primarily focusing on hamstring strengthening exercises and inner thigh strengthening exercises to help pull this pelvic half backwards a little bit more, and lots of hip shifts to help release that tension within that posterior pelvic floor. All of these movements helped me to be more comfortable throughout my pregnancy, so it decreased my SI joint pain. It helped to reduce that bladder urgency, decrease the discomfort within the bottom half of my pelvis or that pelvic heaviness. And it also helped my baby to better engage into my pelvis. And so if you recall, that right half overactivity and tension in the posterior pelvic floor was decreasing space in the back half of my pelvic floor. So it was kind of squishing everything up and pushing my baby more forward into my bladder. And so once I kind of released that overactivity and released the tension within my pelvic floor, it created a lot more space for my baby to push back and drop into the pelvis. And so she was really well engaged when labor began. So how did all of this preparation translate to a better birth experience for myself? And so my early labor was just as long as it normally is. Things just take a little bit of time to kind of build up and work for me as I kind of wait for everyone to get there, wait for childcare, kind of get everything set up. So my early labors tend to be like 12-ish hours long. Once the sun set, things really picked up for me and they progressed really fast from there. So once active labor began, my baby was born about an hour and a half later after about 5 minutes of pushing with no tearing. And this was actually my first water birth and the first birth that I actually caught my own baby, which was super cool. During my labor, I felt like I was holding a little bit of tension within the pelvic floor because my contractions just felt really intense. And so I was finding different laboring positions where I was just kind of shifting my weight from leg to leg and finding that hip shift on both sides. And that was really helping me to release tension within the pelvic floor, which I'm sure contributed to why my labor was progressing so quickly. I tend to find that the more you can relax with your contractions, the better they can work and the faster things kind of go. And so, like I said, once active labor began, an hour and a half later, I was pushing. I pushed about 5 times, and then my baby was born. I pushed her head into my hand, and then the rest of her body came right out, and I had no tearing at all. I really contribute the things that I was doing during my pregnancy to help my labor be so much smoother because I was doing tons of pelvic floor release exercises. I was doing a lot of strengthening exercises to help create space within different parts of my pelvis. And then also because of all the pelvic floor release exercises and preparation exercises that I was doing, my baby was in like a really good position when labor began. In my previous births, my babies were like kind of engaged, but not like fully engaged. Their heads are kind of in funky positions when labor began. And so it just took a little bit of time to get them into a really good position. While for this one, she kind of started labor in that really awesome position. And so things can just progress much faster from there. If you want to listen to my entire birth story for this last birth, check out episode 82 on the MamasteFit podcast, where I share my home birth with my baby Zoe. And so overall, the exercises that I was doing during my pregnancy helped me to be more comfortable throughout my pregnancy by releasing tension in that left posterior pelvic floor and then also offloading the right half of my pelvic floor. It helped to decrease the bladder urgency, decrease my pelvic pain, and then also to decrease that sensation of pelvic heaviness that was just making me kind of uncomfortable towards the end of my pregnancy. And so the exercises that I was doing helped to relieve a lot of those issues to make me more comfortable at the very end. When it came to labor, because I had done all these exercises, it helped to release that uneven tension within my pelvic floor, which really helped to support my baby's position for birth. And so she was able to drop down into a really good position very quickly. And so labor progressed really fast from there. And then when it came to pushing went really quick as well because I was able to release tension within my pelvic floor fairly easily. And then I didn't tear at all, which again, I think a lot of that deals more with my provider. She believed that not everybody has to tear. I had a water birth. And then I was also able to be really in tune with my body and control as my baby was coming out. So I knew like when I needed to pause, when I needed to push a little bit more as she was crowding, which I think really helped to decrease my risk of tearing. Overall, it was a really positive birth experience, and I was really glad that I did those exercises during my pregnancy to help prepare for that. And again, if you want to see the exercises that I was doing, check out this week's workout video where I share my pelvic floor birth prep exercises. It'll be linked to this video down below. So you can absolutely prepare your pelvic floor for birth, and it can be really helpful to have an individual assessment with a pelvic floor physical therapist to understand what is going on with your pelvic floor. And you don't always need to have an internal exam, so if for whatever reason you don't want an internal exam or you can't get one due to any sort of complications with your cervix, then you don't have to get an internal exam. Usually we can tell externally what is going on with your pelvic floor based on your movement patterns, and the internal exam is just kind of there to confirm things. And so with pelvic floor physical therapy, your pelvic floor physical therapist can kind of assess your movement patterns and see what's going on to figure out what they can do to help make you more comfortable towards the end of your pregnancy, in addition to help prepare your pelvic floor for birth. Some pelvic floor PTs will also kind of go over pushing with you, where they'll kind of go over different techniques and help you kind of feel what to expect with pushing, because it is a little bit different from pooping, but it's a similar sensation. So there's a little bit of nuance to it that a pelvic floor PT can kind of walk you through. There's a lot more to the pelvic floor than just deep squats and butterfly poses, and so we need to incorporate different types of exercises to target different portions of the pelvic floor, because there's no one movement that opens the entire pelvis, and there's no one movement that stretches the entire pelvic floor. You can learn more about your pelvic floor in our online courses. So we have our prenatal fitness programs. We incorporate tons of pelvic floor focused exercises. We have our childbirth education course where we talk about the pelvic floor and how it relates to labor. And we also have our pelvic floor prep for birth course, which talks specifically about the pelvic floor, how your rib cage impacts it, how your leg positioning impacts it. And then there's a bunch of mobility workouts within it as well. You can bundle all three together to save 15% off, and you can use code MOMENTS10 to get an additional 10% off. You can check out all of our courses on our website at mamastefit.com/bundles, especially if you want to bundle them together. And again, use code MOMENTS10 to get an additional 10% off. If you enjoy this episode, be sure to subscribe to the channel so you get notified whenever we release new episodes. We release a new Moments with MamasteFit episode every other Friday, where you can learn from our professional experience, where we discuss a case study, what the issue was, and how we solved it so that you can have a more comfortable pregnancy, birth, and postpartum experience.